Now, this is a very interesting case which you have to talk about. This is happened in again from Chennai. This is a person, this is Dr. X, who was a personal physician to one of the ministers from Northeast, I think it is from Nagaland. He came down to Chennai Apollo hospitals for surgery, and when he went for surgery, the minister was very particular that he wanted only his tribe blood to go into him. So, the doctor donated it. When the blood transfusion was given, it was someone else's blood that was donated. So, the minister was upset. The hospital told him that the blood of your physician is contaminated with HIV. This is what happened, and this man was supposed to be engaged to get married to his, he went and broke the marriage because of some other reason. The minister went back, called his fiancée and told her that this man is HIV positive, don't marry him. So, he sued the hospital for breach of confidentiality. Okay, so, when this court went into the Supreme Court in the first time, this was heard by a single bench, and the single bench, this is when the Supreme Court said marriage is a covenant, it is much more than a contract, and it also said HIV is fatal and the spouse has to be saved, right to privacy of the patient is lost. It also said as a corollary, HIV positive patients cannot marry. This is the thing that they talked about. So, this case was appealed to, and in 2002 again this case was reviewed and they came to a conclusion. The Supreme Court said what the court has talked about marriage does not stand, because it was not the contention of the case, okay, but it upheld the Apollo hospital breaking confidentiality. Okay. As a result of this, the second case, which was two HIV positive people asking permission to get married, was granted by the Supreme Court. So, today HIV positive people can marry. They have to inform their status. Two HIV positive people can marry. HIV positive man or a woman can marry if it is a non-HIV person, provided they inform them about their marriage, about their HIV status. Now, we have a whole lot of judgments which are in favor of not discriminating HIV infected patients in relation to employment. Okay. They are all there. There are two cases that I have put classical cases. The first one is what talked about it. The Supreme Court, the Bombay High Court for the first time used initials instead of calling the person's name for it. And they said no person could be deprived of his or her livelihood except by procedure established by law, and that procedure must be just, fair and reasonable. So, if you want to dismiss an employee, you cannot just dismiss him because he is HIV positive. You have to have an inquiry, and the inquiry should prove that this person has not done his job, he is late for work, he is not coming regularly on time, and it is go to the due process, only then you can describe. And it held that if a person is fit to perform job functions, is otherwise qualified, does not possess a substantial risk to fellow workers, a government public sector cannot deny him employment because he is HIV positive. Okay. So, all the cases have gone through this stage. Now, the second point that we have this case is just to highlight how the courts are so well reasoned out. Here what happened is a Navy person, he was working in the submarine, he was found to be HIV positive and he had pulmonary tuberculosis. So, they boarded him out and put him on shore duty. Now, once you are on shore duty, your privileges and money comes down, because you do not get special allowances for going inside the submarine. After that, when this post fell vacant again, he again appealed saying that I want to go, and the commandant of the Navy refused to give permission. So, he went into the court, and the court upheld the commandant's thing, saying that it is necessary that this person should not go into the thing because it is a risk to the society. In a submarine, it is a closed thing. If this fellow gets infected with any other organisms, there is no treatment available. If he develops tuberculosis, he can spread the infection inside the thing. So, it is not that if it is HIV positive means nothing can be done. There is, depending on the situation, you have to take action. Okay. Then we talk about public interest litigation for litigations. NAS Foundation was what they talked about homosexuality to remove the section. The High Court removed, did not entertain it, because saying that you have not been prosecuted, why do you want to fight for someone who is not involved, he is not before the court. But the Supreme Court asked the High Court again to reconsider the situation and test on this judgment. The second one is in relation to dance bars in Mumbai. Here people said our occupation is lost we have lost livelihood, so we need to go back and get permission. The Supreme Court was very clear. It said dance bars, girls can work in the dance bar, but they cannot dance. So there is no question of losing your livelihood. That's the argument. The dance bars, dancing is a small part of that bar. There are so many other work which you people can still do, so it cannot be allowed. And it also not only it reprimanded the government also for doing certain provisions on this, how you can allow dance bars in 3-star hotels, not in dabas, okay, which again is not the due process of law, and Maharashtra government has gone and appeal against this. Okay. Then there is another one thing which is called by an organization called Sankalp, which is not yet decided. They are appealing, saying that the government should do everything for HIV positive patients. Okay, this case is still going on in the court. Okay, then there is an important thing in quackery. People who are from Kerala will be very familiar with Majid. Majid was a chemical engineer who became in the beginning as a homeopath, then he became a naturopath, and he produces a drug called Immunoq, and there has been lot of claims on it, and we know that it is a bogus drug. So the Kerala drugs controller did not give permission for manufacture of this drug. Majid went in appeal against the Kerala High Court. Kerala High Court allowed him to manufacture the drug. Then the positive people went to the Supreme Court with a special leave petition asking that drug should not be manufactured. The Supreme Court again asked the Kerala High Court to enforce that the drug is not manufactured, and the Kerala High Court has to decide whether it is effective or not effective, and then allow its manufacture or not allow its manufacture. That is the last thing that I talk about. This is the HIV bill of 2007, okay, and this document is ideal. Okay. It talks about every possible situation, but how much of it is going to be implemented, I do not know. It when emphasizes there will be a HIV authority in India who will decide on problems that arise because of discrimination, stigma and all these things. So they will be the major thing that they will be handling. So it is still tabled on the parliament. So we do not know how many of these provisions will be carried, but it's a very well detailed textbook like laws that are done for protecting the people. But the problem with that is it only looks from the HIV positive people. It does not take into account the problems the medical fraternity will have when implementing this thing. I think this is the last slide. I shall stop here. Any questions?
This is regarding the opt-out in the PPTCT program. Yes, the government is very happy that more than 90% are coming into it, but I will raise a question. We can divide the women who are coming into this service into 3 groups. The first group, they counsel as a group or individual, they agree readily. The second group of women, they are hesitant to undergo that, and there is a negotiation or some sort of counseling going on, and in that process, it is implicitly told to them that if you don't do this, probably the doctor will not see you, because this is a process. A patient cannot go directly to the doctor. She has to pass through the counseling center and this and that according to NACO policy. Yeah. And third group of women, they again refuse to go for this, and they go to the doctor again. The counselor sends to the doctor, and doctor counsel this and that, and some of them agree to do the test, and some of them again, very few of them of course, disagree, and they went out not doing this HIV test. In the second group, where there's some counseling process is going on, implicitly, that is what I said.
There is coercion in the second group.
Yeah.
Okay. That is not acceptable.
Yeah, this is one my question.
You can talk to the patient and tell her that is necessary for you. We are in a high prevalent state, so it is essential that we need to test you. But not using a threat. If you don't do this test, doctor will not see you. It's unethical. It's illegal.
Yeah, that is the usual practice.
Yeah.
And when we talk about 90% attendance and all, they did all the tests. But out of that, how many of them came to get the results?
Yes.
And out of them, that can be looked into and see whether that 90% is really 90% or not.
No, there is always a difference between the people who undertake testing, people who come for results, and people who actually take the this thing. Unfortunately, I just do not remember the figures, but there is a lot of difference between people who undertake testing and people who come for results and people who actually get the drugs. Now, there are many reasons for that.
Okay. The second one is not a question. I just put it for the members to think of it. There was a statement saying that the number of people living with HIV is much, much less than the number of people who are living on HIV. How ethical this statement is, I don't know.
That is more like in Northeast. Okay.
Section 377, the case filed by Ashok Kavi from
Yeah.
us. So one strong argument from the other side is that homosexuality or same-sex behavior is not by choice. They say that it is there in your genes. So as a person equally qualified in medicine as well as in ethics, I would like to get your opinion on that.
Which see,
Whether it is by nature or nurture,
see,
or both.
See, for anything to happen, I am talking about basic community medicine knowledge. Three things have to be there. There should be a genetics or the host factor, there should be an environment factor, and there should be an agent. All three have to be there only to this. How much of what contributes, how much of percentage to what disease is still not determined for many of the things. So it is like that. All three are necessary. You may have the genes, you must have an environment.